Hi, this is Dr. Erica, pharmacist. Thank you for joining me on this live topic. I am coming to you to talk about beyond use states. Beyond use states, before we get started, please like, share, and subscribe. Beyond use states are, are very particular because beyond use states want to preserve manufactured medications based upon their sterility, water content, based upon the temperature also. So, with that being said, products that are punctured, products that are used in home infusion, in hospital settings, those medications that are utilized for medication treatment are giving a beyond use state so that the patient is not receiving expired medications that could be detrimental to the outcome of their prognosis. So we want to make sure that medications such as that come in the sterile vials, antibiotics, all types of medications that are in the home infusion and hospital setting are giving a expiration date or beyond use date. And those dates are usually dependent upon water content of the product. It could be based upon also the risk level, which will include the number of punctured doses entering into a vial. It can also be determined upon the number of vials that are being punctured as well. So, again, the number of vials that are being punctured, the number of punctures per vial, also water content can determine a final product's beyond use date before the patient receives the medication to be in certain status that this patient will survive after taking this particular product. So the risks level is low, medium, and high, and the beyond use state is also determined upon the temperature of its surroundings, of its storage, whether it be room temperature, refrigeration, or frozen sections. It could be dependent on those three items as well as the water content also. So be aware of that. Now, this particular video is for mainly for students, medical students, mainly pharmacy students, just because parental training and aseptic technique can be a review of the uh, original class, or it could be a new information for, again, students. So I did take a course just to give some background information. I took a course um, on aseptic technique. And one of the things that we learned or were tested upon was our skill level, technique, of course, and then also our reading and studying and our testing of the material. And so, what I learned was, I'll share it with my YouTubers out there. What I learned was that medium, high, and low, medium, and high risk uh, can be hours at room temperature, just in general information. Room temperature is usually set for hours again, and the higher the risk, the lower the hours. If it's a high risk product, it's usually going to be just for a few hours that the medication can be at room temperature, or at refrigeration, it will likely be just a couple of days, up to 9, maybe 10 days, or at frozen temperature, a couple of months or a month and a half, just depending on, again, whether it's has a certain amount of vials that are punctured and the number of punctures per vial. And so, again, that is what parental pharmacy is going to look like. Parental skills and training is going to look like. Just in I'll give a given a general overview of that. So do consider becoming certified, and it is rewarding. I did retail for most of my pharmacy career, and now I am more of an independent consultation, more of a advisor of pharmacy. So I do recommend receiving that extra training post grad pharmacy school. All right, so that's all I wanted to share on this particular video. Again, there are some institutions that do offer the course for the continuing education to ensure upkeep of the training, and there's also institutions that initiate the training and initiate the class, which is usually a one-day class for a few hours. You go through an examination and a tutorial, and then after that, the second half of the course is going to be actually on hand training, where you're actually under the hood, and then you're gowned, you're washed and you're gloved, and you have your utensils, you have your material, and you're being monitored by an examiner, and they will give you your final score for approval and for moving forward with the certification. So be aware of that before going in. There's nothing really to there are some things to study for, because they will test you before going into the on hand section of the course. So usually beforehand you will do some reading and some studying. So do be aware of that. And I do highly recommend it as well. So if you're new to this channel and you want to learn more about what pharmacy school is like, what parental training aseptic technique is like, please subscribe. I upload videos weekly, um, mainly a couple of times a week, just to give some medication information and provide that. And please like, share, and subscribe. Thank you for joining me. I'm Dr. Erica, signing off. Goodbye.